marketing manager for Fosse Healthcare. My background has always been marketing, but I've come into this role, and my role's kind of evolved into the recruitment process, because that's our job in a nutshell. Is marketing and recruitment go hand in hand. We use all the data and analytics to influence our recruitment, and my role just naturally forms into that side of things. So my role has always been marketing, but I'm heavily involved in recruitment now. Yeah, so we're one of the leading care providers across the East Midlands. We've got branches throughout the East Midlands, delivering home care, care home, support services and healthcare services. So it's providing carers out in the community, as well as kind of your support services, nurses, support workers, that side of things. So we're a big player in the market, and we our kind of background is to support people out in the community, and supply nurses for the NHS, support people with learning disabilities and things like that. At the minute we employ around just over 1,000 carers, nurses and support workers. Like I said, they're spread out across the East Midlands. Okay. And beyond, actually, because we have nurses that we also supply throughout the UK as well. So it's through the East Midlands and beyond. So the majority of my work, I'd say 90% of our recruitment process is digital. The digital side of things is basically the majority of my work. It's 90% of what we do as a company involves the digital technology and that side of things. So everything from the marketing and advertising to the onboarding processes. We're on job boards, we're on social media, we do all sorts of paid advertising with Google and things like that. So everything we do around recruitment, bringing people in, like I said, getting them through the door, involves some sort of digital technology on the way. We do external marketing and advertising campaigns, but everything we do really comes through the digital system. So our primary things are job boards and social media for the actual advertising and trying to attract people into Fosse Healthcare. So Indeed, Facebook are our main two sources of spend when it comes to actually bringing in candidates. But then from then on, we use Recruitive, which is an ATS system, when it comes to onboarding and tracking all of our candidates. So from contacting them, from moving them along the recruitment process from start to finish, we use our ATS tracking system, which is an absolute godsend for us. It's what we need to do our work, basically. It's improved it massively. So before, everything we did was kind of here, there and everywhere, whereas this is a streamlined approach where everything falls into one place. Our recruiters, from the moment somebody applies for a role with Fosse Healthcare, our recruiter, the first contact to bringing them in as a new starter, everything is through that ATS and the job board and that integration. Everything in between that you can think of in terms of onboarding and processes to bring somebody in through that employment process is what we use, and it's something that we couldn't function without. I guess the only real challenges I can see is obviously we're heavily reliant on this information, and this information staying where it needs to be, so we can access it all at any given time. We need to be able to access an employer's documents, and to be able to bring those people in. We need all their data. So I guess the only challenges I could see is, because it's all heavily based on the technology that we use, if that technology was to somehow fail, or we couldn't get access to that, then we'd be, as a business, shut down really, because we need to be able to access that information. So that's the only challenges I can see. Everything else is just, it's a vital part of our processes. I think the only way it will improve is through automation. Automating absolutely everything in the recruitment process for us. So when documents need to be sent out, rather than having a person behind the system that sends out these at certain times, it's that automation that I could see it really evolving to almost the tech almost doing it for us. So from the start to finish, when anything ever needs to be sent out, it sends out itself. We receive the documents, it then moves on to the second process, vice versa, until they become a new starter. I think
we're seeing a lot of that happen now, but I think it's only going to keep evolving, and to the point where it would never make recruiters' jobs obsolete, because you always need that human touch. But that process and the automation from start to finish of onboarding and getting them through the door, I think is definitely going to be something that will evolve going into the future. Yeah. I suppose for us as a care industry, it is finding the tech that is kind of bespoke to the care industry. So at the minute, there's a lot of recruitment tools out there and a lot of resource out there for us to use, but care is very, very different in the sense that we need a lot more things when it comes to the digital technology side and the onboarding processes that other recruitment or employment agencies might not need. So the things that we need in the onboarding process and things other companies and generic recruitment processes they might not need. So it's trying to find that. And I suppose the other challenging thing for us is getting the recruiters on board. Recruiters are very not stuck in their ways, but they like what they know. So when we're trying to bring new technologies in, it's trying to bring them on board with it and get them used to the systems, making it as easy as possible for them. And I suppose the challenges there are trying to get them as clued up on the technology as the people that are delivering the technology for us. We do, obviously we're in competition with our care providers across the country as well, but when it comes to technology and the things that we use, we're actually very helpful to one another, because at the end of the day it's something that's going to improve the care sector, and it's something that's going to improve the process for everyone, and it's not something that we need to gatekeep or anything. So a lot of the time we share ideas with other providers, we go to events, we use search engines to find what we're looking for, and then we'll obviously meet up with the people that are providing the technologies to see if it's something that they can provide us with. Often will involve some sort of bespoke package that we need to have, because like I said, with the care industry, we need packages that are kind of tailored towards us. So a lot of the time the technology is there, but it needs to be kind of touched up in a sense that makes it more effective for us to use. Yeah, a little bit. So I touched on obviously the time it takes us to bring people through the door. We're heavily looking into times to hire and the cost per hire at the minute. So we use the data to see how long it's taken us to bring people through the door, and how much that's having an effect on us cost-wise, and in terms of the amount of people we need to bring on board as well. So everything we do, we look at kind of quite granularly, and yeah, it's something that we heavily rely on. It's something, the data that we use is all based around how much the cost savings and the time it takes us to do things. I couldn't really answer in too much detail. We have an IT team that are dedicated to that, but I know that it's something that we massively, heavily reliant, especially in the care industry. Client data as well as employee data is absolutely massive for us. And being in the care sector, it's heightened even more. So GDPR and the cyber security side of things is absolutely massive for us, and we put a lot of effort into making everything that we do digitally secure as possible and as safe as possible, and we make sure that all of our clients and our employees know this as well. Okay. Yeah, a little bit. We work with councils across all of our branches. We work in collaboration with all of them across the recruitment side of things. So it sort of goes hand in hand. We work together on everything when it comes to recruitment, to safeguarding, to the security, GDPR. Everything we do is kind of in collaboration with the communities and in turn the councils that we work with. So yeah, it's absolutely massive. Honestly, absolutely massive. So I would say before we bought in our careers website, we were using obviously Indeed and Google and Facebook and things which are great, and they still work absolutely fantastic. But having that careers website where we can bypass those things to bring them into our website, and in turn they get more of a feel for our company. They'll go on there, they'll go through our pages and see what we do and who we are. It's massive, and we're seeing kind of a trend now of a lot more organic recruitment in terms of people coming through our website, actually finding us organically and then applying through our website.
and it's it's massive for us really. Everything goes hand in hand. So in the Indeed and Google, Facebook, everything, but with our careers website, everything goes hand in hand. Yeah.